First off, the cause. Dengue fever is caused by the dengue virus, which is transmitted through the bite of an infected Aedes mosquito. These mosquitoes are typically active during the day, with peak biting times early in the morning and before dusk. Now, on to the symptoms. Dengue fever usually starts suddenly with a high fever, severe headaches, pain behind the eyes, joint and muscle pain, rash, and mild bleeding, like nose or gum bleeding. The illness has 3 stages: febrile, critical, and recovery. In the febrile stage, which lasts about 2 to 7 days, patients experience high fever and may feel extremely unwell. Other symptoms include severe headache, pain behind the eyes, muscle and joint pains, nausea, vomiting, and a rash. It's crucial to stay hydrated and rest during this phase. The critical stage follows and is usually around the time the fever drops. This stage typically lasts 24 to 48 hours and is the most dangerous period. During the critical stage, severe complications can occur, such as plasma leakage, fluid accumulation like ascites and pleural effusion, respiratory distress, severe bleeding, and organ impairment. Close monitoring in a healthcare facility is essential to manage these risks. Additionally, complications like hepatitis and gallbladder wall edema can lead to right hypochondrium pain. Finally, the recovery stage begins, where the patient generally starts feeling better, but close monitoring is still necessary. This stage can last 2 to 3 days, and patients may experience fatigue and a slow return to normal appetite and energy levels. To diagnose dengue, doctors usually perform a complete blood picture, CBP test, and look for specific signs like low platelet count and elevated hematocrit levels. NS1 antigen test and dengue IgM and IgG antibody tests can also be used for confirmation. When it comes to treatment, there's no specific antiviral treatment for dengue. Supportive care is the key. This includes maintaining proper hydration, rest, and using paracetamol to manage fever and pain. Avoid aspirin and ibuprofen as they can increase the risk of bleeding. Monitoring is crucial. Regular CBP tests help track platelet levels and hematocrit. Typically, doctors will closely monitor these levels if they suspect severe dengue. Speaking of platelets, a common question is, when should platelet transfusion be considered? Generally, platelet transfusions are reserved for severe cases, especially if there's significant bleeding or platelet counts drop below 10,000 per microliter. Prevention is better than cure, right? So, let's talk precautions. Use mosquito repellents, wear long-sleeved clothing, and ensure your home is mosquito-proof by using screens and nets. Eliminate standing water around your home where mosquitoes can breed. And if you live in or travel to an area with dengue, be extra vigilant. Lastly, watch out for warning signs of severe dengue. If you or someone you know with dengue experiences severe abdominal pain, persistent vomiting, rapid breathing, bleeding gums, fatigue, or restlessness, seek medical help immediately. That's a wrap on dengue fever. Stay safe, stay informed, and remember, if you suspect dengue, consult a healthcare professional promptly.